my name is Flemming Forsberg. I'm a professor of radiology at Thomas Jefferson University in Philadelphia, and I work with ultrasound contrast agents, which are essentially very, very small gas bubbles about the same size as your red blood cells, for about, longer than I care to remember, but let's say 15, 20 years by now. In particular, I have research right now moving into clinical trials, trying to help and benefit patients, looking at new ways of imaging breast cancer. One of the things we have with breast cancer is it's easy to find the lesions, but it's very difficult to find out what sort of lesion it is. 80% of all the biopsies, in other words, 80% of all the needle passes that we send through women's breasts, because we're concerned about some abnormality in their breast, turns out to have nothing to do with cancer. That's obviously good news for the individual woman, but it's very, very bad news for our healthcare costs, for the time spent, for the worry and anxiety for the individual woman before she gets these results. So one of the things that we think that our bubbles can do for us is help better differentiate between the lesions that actually are nasty, meaning cancer, malignant, and the ones that are much less worrisome. And we have some new ways of imaging those that we think will make a big impact, especially if we go to a volume format where instead of doing the traditional ultrasound where you take a single slice through a section of tissue, in this case for breast, through the breast, we can capture a whole volume, so a larger volume of data, which will give us a better overview of some of the blood supply and some of the factors that sit around what hopefully isn't a cancer or is a cancer, so we can differentiate the two. The other thing that I work a lot on is trying to use these bubbles as non-invasive pressure sensors, which is a fancy way of saying that it can measure the blood pressure inside your body. Now, obviously, most people have tried this by having a cuff put around their arm and just measure the pressure in the blood vessels at the brachial artery. But that's not the same pressure you will have inside your heart, and it's significantly more cumbersome to put a cuff around the inside of the heart, or to look at pressure, for example, in the liver in something called portal hypertension, which is where the pressures in the livers are elevated to a degree that could be dangerous for the individual. So we have some ways of monitoring specific signature signals from these bubbles, non-invasively. In other words, as the bubbles circulate through the bloodstream, we can image these bubbles and pull out specific signals which match up with the pressure measurements that today we take clinically by spinning long plastic tubings, metal catheters through blood vessels that we open up people's neck, not in the vampire sense, that's just more Twilight, but just a small cut to spin catheters in to do pressure measurements inside the heart or inside the liver. And we have found methods whereby using these bubbles and these specific signatures, we can come up with the same information. And we are currently concluding a trial in patients at the moment with with so far fairly encouraging results that we're hoping to take to a larger populations as we go along.
Do you think CEUS is safe?
It's incredibly safe, and especially we should compare it to what you can look at in other imaging modalities. So if you look at imaging modalities like CT with contrast, CT is computer tomography where you use X-ray and radiation. So there's the radiation in and of itself. And unfortunately, the contrast agent, the enhancing agent we have to use to make the CT better can have some rather unpleasant side effects, and also likewise with magnetic resonance imaging with MRI. Unfortunately, some of those agents have been found to have a negative impact on people with reduced kidney and renal function. So if we compare, the most experience we have is in cardiology and looking at these bubbles in the heart. And we find there that we have a risk ratio about 1 in 10,000, which if you hear it at first you say, ooh, that's not good if they just scan patient number 9,999 and now it's my turn. But what it really should be compared to is that when we take patients without our bubbles and put them, for example, on a treadmill to do what's called a stress heart scan, a stress echo, there's a 1 in 250 chance that people will have a reaction to that just by the exercise on patients that already have a weak heart. And we have a way of avoiding that by using the bubble to take a look at some of those parameters without throwing elderly patients with weak hearts up on treadmills.
Cost? Is it expensive?
How do you define expensive? It costs less than a pair of shoes.
Compared to other?
Yes, compared to other imaging modalities, it costs about $100 additionally to add to an ultrasound study in order to complete most of the contrast CEUS studies that we currently are investigating, which is a relatively low price. And in particular, what should be borne in mind here is that compared to other imaging modalities such as MRI and CT, which we just talked about, ultrasound is, to begin with, half the price of CT and a quarter of the price of MRI. So we're looking at a few $100s for an ultrasound scan versus $900 to $1,200 for an MRI, and CT is somewhere in the middle of those. So adding $100 for a contrast agent is not that expensive, and much more importantly is, if we get similar, or in some cases even better information that we can get with other imaging modalities, the big money saver really comes from not having subsequent imaging studies. You know, if you do a study and you're in doubt, you do more studies. More studies cost more money, which is obviously excellent for employment for individual physicians, but maybe not so good for the individual patient, and certainly not good for the healthcare costs in the United States. So there's a huge savings to be had here if we could convert more of those more expensive studies to the cheaper and, as far as we know right now, equally effective CEUS studies.
Seems like other countries use CEUS in more ways than we do. Are we behind the curve?
No, we're not behind the curve. We are miles and miles and miles behind the wagon trail that left about a decade ago, unfortunately. These bubbles are approved for use in virtually everywhere else on the planet. They have been given to, by now, millions of people, which is why we know about the safety risks, or the relatively low safety risks associated with such studies. Unfortunately, there's very limited indications that these agents have been approved for in the United States, and unfortunately it does mean that there are patients, Americans today, who are not getting the clinical care up to the standard that they would get if they happen to be Belgium. I mean, you know, how much more terrible can I say?